So without further ado, I am really excited to have our speaker today as part of our data and evaluation series for the Bairns Hoose Knowledge Exchange programme. And so we're going to be hearing today about the story so far. So we're going to hear about the North Strathclyde Bairns Hoose Phase 2 findings, and this is the evaluation of Scotland's first Bairns Hoose. And this report was released on September the 18th, 2024, so it's hot off the press. Many of you will already know this, but North Strathclyde Bairns Hoose evaluation was led by the University of Edinburgh in partnership with Children First and Victim Support Scotland, and it has financial support from the People's Postcode Lottery Dream Fund. The session today will be delivered by Dr. Mary Mitchell, and she is a senior lecturer in social work at the School of Social and Political Science in the University of Edinburgh. Mary qualified as a social worker in 1998 and has practiced in children and family services until completing her PhD in 2018. Mary has research expertise in using mixed methods, realist evaluation, action research, and case studies to explore the multi-dimensional nature of many practice problems. She has an international reputation as an expert on two specific welfare models, Varna House, which of course many of you will be familiar with, and family group conferencing, which is an internationally recognised decision-making process and aims to empower and involve children and their families or vulnerable adults in safeguarding planning. So Mary is the principal investigator for the realist evaluation of the first Varna House. She is also the principal investigator for the evaluation of the Aberdeenshire Bairns Hoose Pathfinder, Aberdeen City Bairns Hoose Pathfinder, and the Sycamore affiliate. And Mary is also a co-investigator on a project working to establish a European Varna House evaluation framework with the Oak Foundation and the European Varna House Network, which many of you might know as the Promise Network it used to be called, which thankfully in Scotland they have changed their name. There's a lot of things in Scotland called the Promise. And Mary is also a co-investigator on family group conferencing and adult social care and mental health, exploring how it works and what a difference it can make in people's lives, which is funded by the National Institute of Health Research. So we are absolutely thrilled to have Mary and Mary's expertise today, and we're going to hear all about the North Strathclyde evaluation. So Mary, without further ado, over to you.
Thanks so much, Rachel. Great to see everybody. There's some familiar faces. Well, I'm not actually seeing your faces, but great to be here today. I'm really delighted that we've got the Phase 2 evaluation report hot off the press. So today I am going to really do an introduction to the study. I'm going to give you a short reminder of the Phase 1 findings, and then I'm going to dive on into the Phase 2 findings, and we're going to talk about children and families' experience of the system change in North Strathclyde from children's perspectives, partnership and systems change, North Strathclyde Bairns House space and what people are saying about the space, the recovery model and Children First recovery model, and key learning. And then hopefully at the end we'll have a bit of time for any questions if you have some, and do put them in the chat. I can't see people at all, so if Rachel's going to tell me if anybody you want me to stop, and also Rachel, if you could give me a heads up if I'm running out of time so I can speed up or not, as the case may be. So just to give you a bit of an idea of what we've been doing in North Strathclyde for the last couple of years, last 4 years in fact, is that we've had, as Rachel pointed out, we've been working in partnership with Children First and Victim Support Scotland and what was Children England to establish the first Bairns House, and our role within that was to really do a formative evaluation of the development of Bairns House, and then as it opened, kind of starting to understand the experience of Bairns House. We had 2 phases. The first was really at the very early stages prior to the house opening, scoping and characterising what the Bairns House was going to look like and what people wanted to hope for it, so the kind of program theory around that. And also we had opportunity to kind of consider what the system is from the professionals' perspectives in North Strathclyde. The second phase, which I'm going to focus today's session on, is primarily about understanding the North Strathclyde kind of in the 6 months after it had opened, and talking about some of the assumptions and testing the assumptions that were developed from the program theory in Phase 1. So just to give you a bit of a heads up of where we got to at the end of Phase 1, because I think it's quite important to consider this report as a continuation of the overarching findings from Phase 1 and Phase 2. So in Phase 1, which was released last year in March 23, we found we had 3 core elements that we discussed. So we were talking about the system as is or as was in North Strathclyde. And we found really, and what we had done is really talk to professionals in North Strathclyde about what they thought was happening for children. And we found really that children affected by abuse really are experiencing systems and services in a way that that was quite harmful in some ways with them. So they were seeking support, but actually in many circumstances, they were also finding it quite harmful. And one of the core findings that we found was that the system does not know itself particularly well. And what I mean by that was that there was a lot of assumptions by different agencies about what other agencies were doing to support children. And I'll talk a bit more about that as we go on, and how the Bairns House might be an interrupter to some of that circumstances for children. The other things we found were about enablers and challenges and tensions associated to change and creating system change at a very early stage. And we surfaced quite a lot of assumptions, both about Bairns House, but obviously, as I've said, also about how professionals operate in a multidisciplinary way across North Strathclyde. So the kind of key summary of those findings is that really at that time, children's rights were not really being upheld, despite, I have to say, really best intentions and cross-sectorial commitment to making to try and address children's rights and to embed children's rights into children's the delivery of services for children. There was a shared high vision about Bairns House, but still there was a need for further authorisation for both operational people in North Strathclyde to make changes within their own service areas and beyond their own siloed thinking. There was significant progress made towards the development of the Bairns House in spite of challenges. And if you remember, with North Strathclyde, the money came in 2020, and of course that was during the point of COVID. We had the Ukraine war and other socio-political issues that were happening at that time. And so it was a cost of living crisis as well. So there were a lot of concerns and delays based on those, because the cost of the actual house and developing the house really magnified at that point too. Which meant that there was a need to think about an emerging model and to adapt the response to what Bairns House was being developed at that time. There was continued ongoing uncertainty about the practicalities in North Strathclyde implementation. And at the time we wrote that report, there was really, because people didn't know what the protocols were, what the roles and responsibilities were, there was a sense that that had an impact on professional buy-in to the commitment of Bairns House, and that North Strathclyde did a lot of work to try and build and rebuild people's commitments to the vision as these change and the dynamics change over time. And as you'll know from your own experiences, multi-agency collaboration is really based on a mutual trust and an understanding of what the core ingredients of what you want to make happen for children, and the success of Bairns House relies on that. And that requires constant focus, I think, and we'll find that within phase 2 as well. But also, just because we're saying we're developing a Bairns House doesn't mean that everybody's on the same page about what that vision actually is. And I think the final finding we had from phase 2 was that there was a need for further cross-sector responsibility in the sharing of resources and the delivery of Bairns House. There was a risk that at that point, that because of the delays in the build and the delays in a whole range of things, that people were going to step away from being able to deliver it to its full impact. I think the other thing that's quite useful before we start on to the phase 2 findings is kind of get a sense of where North Strathclyde were at the point of August 23. So at the point that we were writing the report and beginning the findings of the beginning to look at what was happening in phase 2. So Camille Warrington and myself kind of worked on thinking about the program theory and also that underpins the Bairns House in North Strathclyde, but also thinking about what the core elements, what the core architecture of the Bairns House is. And I think we've come up with 7 core elements within North Strathclyde, and it's a movable feast, but at the point in August 23, these seem to be, was checked out with professionals at that point. These seem to be the core elements of what the architecture of a Bairns House was. So a single point of contact for children and families, an inclusive, timely access to recovery and support, a purpose-built child-friendly space, coordinated interagency working, including co-location of multi-agency professionals. And The Bairns House in North Strathclyde isn't big enough for co-location, but there was co-location of police and social work and recovery staff not far away from the actual Bairns House. Probably in early 23, I think that actually occurred. And the fifth element is optimised forensic interviews, which is obviously based on the significant work that the child interview team through the Scottish Child Interview Model was creating in North Strathclyde. And in development at that point was an integrated health assessment and remote court links. And I think those are still in development. There's an enormous amount of work gone into creating those kind of 7 fundamental core elements of Bairns House in North Strathclyde currently. Okay, so to move to phase 2, so the actual Phase 2 runs from April 23 to September 24. Just to let you know that the interviews that we undertook with children and family members and focus groups and interviews with staff and senior managers happened in the first 6 months from when the Bairns House opened until probably, I think, March 24. So it's a kind of short period, but so what you're going to get today is a snapshot of that period of time. So we did those interviews and focus groups. We also had a number of knowledge exchange activities from within North Strathclyde and beyond, and we also gathered some statistical information from partners, particularly Children First, about the recovery model. And one of the core elements of what we were trying to do is really understand the assumptions underneath Bairns House and think about the program theory, which the kind of context and mechanisms that were making the Bairns House work. So we focus primarily on the exploration and impact of the Bairns House building and how the space is experienced and conceptualised by both children, family members and professionals who are engaged in work in the Bairns House. And we also focus specifically on the model of recovery used. So really trying to understand the new model that Children First were developing in the North Strathclyde Bairns House. So I'm going to talk about those things today, and then we'll come back and have some key questions if you'd like them to ask any. So before I talk about children's experience, I just wanted to remind you of the system as is that we understood was happening in North Strathclyde prior to the Bairns House coming into fruition. So there was definitely a lack of access to timely and appropriate recovery and therapeutic support. All professionals many of the professionals within our interviews kind of really understood that this was an area that was a gaps in services, and also that it was an under-resourced area because it wasn't being delivered primarily through statutory services. So the child and adolescent mental health services was there, but also there was a large gap for those children following child sexual abuse and maltreatment. There was an extended delays and adjournments to the justice system, not only because of COVID, but because of the manner in which the justice processes work. And that was causing a kind of level of confusion and poor communication to children. And also, if you think about, and you'll know yourselves, the kind of intersection of the many systems that children have to experience after abuse, that the level of poor communication and the complexity of navigating that system became very evident within the work that we were undertaking. And I think the fourth kind of key system sense was that the requirements on children to engage with court processes and the space is characterised as really distressing, and children going into court was actually causing extreme distress to both children and to families. And that actually one of the things that professionals were saying to us is that they felt that those experiences in this system as is was causing more harm often to the children than the abuse itself. So there was a very strong concern across the board in all agencies about the way in which the system was operating at that point. So this gives you a kind of map about the way in which the child might experience the system as is. So it was introduced at a time within an already crowded landscape of services, processes and individual practitioners that children have contact with, from the point of initial disclosure on the left right through to court proceedings on the right-hand side. This is a simplified map of the children's welfare and justice experiences following disclosure of abuse and maltreatment, and the current systems that is meant to happen in after abuse. What you've got here is the green is the professional responses to abuse without direct child involvement. The kind of darker blue is the professional responses with children involvement, so that all of those have children's involvement. The dotted blue is those professionals' responses with children's involvement in some of the cases that come up. And then you have in the kind of pinky colour, children's experience outside professional responses of children continuing to maintain themselves within their own communities and families and friendships and school. I think it's helpful to get a grasp of that, about the complexity for ourselves as professionals within the landscape, but also for children and families trying to navigate those systems. Okay, so I'm going to talk about improvement in children's services first. And I think core to what's going on in Bairns House is very much around the child interview model that was introduced in 2020, in August of 2020. And I think the thing about the child interview model is that it's had it kind of creates a framework of really improved interagency working between the police and social work, and that in the sense of improved communication, but also the delivery of optimised and best evidence around forensic interviews. There's been over 1,096 children interviewed since August 2020, and since September 2023, 141 interviews at the time of the writing of the report was undertaken across North Strathclyde, with 68% of those happening in the Bairns House, and it's become the venue, the optimised venue for forensic interviews in North Strathclyde. So I think it's really important, prior to going into the actual forensic interview itself, actually this Sam's response here about actually having been interviewed twice by police interviews in 21 and 22, and both I had the same person, so that was a good thing. The person I had was sweet. They told me the same things as you, as in the interviewer for the research. I could stop, pause at any time, and I had full control over the interview. Just talking to her made me feel so happy. She told me she told me that where things were, where all the cameras were, and she gave me fidgets. They did everything we needed. She remembered things I told her from the last interview, and that just kind of made me feel good because she remembered me. So one of the things that really resonates with me with Sam's testimony there is it's obviously not an easy experience to go through a forensic interview, and several of them, but actually the way in which the child interview model is manifesting itself and being operationalised in North Strathclyde is really making a difference and reducing the harm that could previously have occurred because of those having to speak about the abuse again. So another area of improved activity for children and children's experience was very evident around the recovery support and the recovery support that Children First has developed. And I'm going to talk specifically about the recovery model in a few minutes. But really, this came from the child interview team, and the Children's First will kind of go in and offer them tea and coffee and then explain we'll be back in, kind of thing, and they go and speak with the parents whilst we're in the interview, which means in the child's break, mum or whoever, you can say, oh, I've just met X or Y or whoever, and they're going to come and chat to you. So yeah, I think it seems to be working fairly well. What happens is the recovery model, with the recovery model, is that there's a duty recovery worker who meets the family as the child comes in for the forensic interview, and so it's and can stay with the parent and add support and chat with them while the child's being interviewed. I think the core elements of the recovery model that's very distinct for the children's experience is that face-to-face contact and a really direct referral offer to the family at the point of the joint interview has really made a big difference to people taking up a recovery service. It provides families and children a kind of opt-in or out with a single point of contact, so that the recovery approach, which I'll talk to you about, offers support across the journey for the child, from both as they go into the Bairns House, but right up until the court proceedings 1 or 2 years later, if need be, or months later. And the kind of role of recovery and advocacy in buffering the system's harm. So really thinking about how the recovery workers support communication and improve communication between services, and also explaining children's rights and what their journey will be to the family again and again, so that they're given the level of trauma families may be experiencing, that they can understand what the systems are offering at certain points. Areas that are still unclear within what we were understanding from children's interviews is that things around initial contact with services prior to the forensic interviews wasn't clear, whether there was any differences that the Bairns House was making. Children didn't particularly talk about that, though they did say it was a very traumatic time for them. There was wider service coordination. We feel that there's a gap around thinking about how social work, children and family services, health and universal education services are kind of linking and will link into the Bairns House. The full potential of the model and the space is still not being met. So children are being asked to travel to the Bairns House, or if they're living further away, they're not coming to the Bairns House for their interview. And that may be having impact on children, as was with the system as is. And again, the justice time scales and the kind of need to testify in court, and whether or not evidence that is being, best evidence is from the interviews is being used within courts, is also not quite being met yet. There is an assumption that Bairns House will reduce the need for children to testify in court, and that's definitely not being met yet. So I think there's a lot of the improvements that are going to happen nationwide, which particularly around courts and health involvement in the Bairns House, which may improve generally across localities. So the next area I'm going to talk about is partnership and systems change. A reminder of where we were at the beginning of the end of phase 1. At that point, we were very clear that the systems were not meeting children's needs or rights. I mentioned earlier about systems not knowing themselves, so there was a real impact on children and families' experience of the system, and actually the confusion about who was working with who, the expectation that some agencies were working with families and they actually weren't, etc. So there's the confusion that raised for children was quite significant. Partnership and leadership was very critical at the point of delivering systems change, and continues to be, and a dynamic element of really considering leadership and partnership is always very important, and I'll talk a bit more about that. Having a common vision and a desire for change was seen as being very critical at the point before the house was being built, but there was also a shift in some of people's views about what that vision was, because there was an emerging model and there wasn't everybody at the table. There was definitely different commitments and levels of time commitment, resources and capacities that people were being able to offer to be involved in the development of the Bairns House. So I think one of the things that's come out of phase 2 is that people were very clear that there has been a kind of different dynamics that have gone on in the partnerships, and that has had an impact on the delivery of Bairns House within North Strathclyde. So I think, and I think this quote from Professional 4 is really quite distinct. I think the Bairns House has always suffered from not having everyone on the same page at the same time, with the same understandings and the same levels of power to affect that change or to influence it. So we had a kind of understanding Bairns House, or making sense of Bairns House knowledge exchange event recently, and I think the "do we share the same why" came out very significantly in that, and actually it changes over time, and reinvesting in a partnership looking at a why and and thinking about that shared why and what the different agencies are trying to deliver at certain points is very important with continuing systems change and delivering the Bairns House. I think in North Strathclyde and Scotland, there's been enormous change happening, and the context that we're working in is continually changing. And so that I'm talking about both legislation, I'm talking about guidance for workers from all agencies, from health, from courts, from social work, from police. And so all of those things has made a big impact of trying to maintain and make change happen. And I think one of the things certainly that respondents talked about in our study was that the pace of change is often exhausting. And so often I think that why gets a bit missed, and people kind of come in and out of engagement with the Bairns House. I think a really significant element of what's happened in North Strathclyde is having a children's rights approach to systems change. So what I mean by that is really Children First have really ensured that children's needs are prominent at every meeting, and they do start meetings with giving evidence from children or a poem from a child who's gone through the pathway that we're talking about, and how much the Bairns House needs to change the systems that are supporting children so that they don't cause additional harm. And that has really influenced strategic and operational discussions at a multi-agency level, and I can't underestimate that. So I think professional servants, testament to that is for somebody who's come from their career mainly in the children and justice world, I think you become, no matter how much you try not to, you become part of that change, part of that program, because you say, actually, this is how it's always been done. And you think about it very much from an adult perspective at times, but what happens is Children First always, and rightly, puts the child at the centre and challenge why these adult things have to be done in the way that they do. And I think that's really core to why people might start shifting their agencies, their systems to make things happen. And I think it's core to have a kind of element of children's rights at the forefront of systems change for Bairns House. I think not only do professionals perceive the change that's occurring in the way of having children at the forefront and really thinking about focusing on children to make change happen, Children First have also introduced a number of participatory approaches to encourage children and young people to participate in being able to help design the Bairns House and create the Bairns House. And they've got a change makers group model of participation that they operate. And I think one of the things that children have talked about in our involvement with them, and I think Clementine's transcript, I think, is really important to listen, to think about. I think the Scottish Government should learn more about how kids get impacted by these events and how court is for children, because they're basing it through adult minds. They're not basing it through the children's minds. And I think as adults and thinking about our own perspectives and keeping in mind children's experiences and the way in which they might be experienced, that interaction and interconnection of those systems is really crucial. This, I suppose, has an impact on siloed thinking. So much of what we've been challenged with around multi-agency working is really thinking about our own mindset as workers and coming together and creating new service and new system that will support and reduce harm to children. It's complex and it's very challenging, and it may seem simple to actually get people in a room and try and get them to chat about creating a new service, but actually we all come from a different perspective. So, for example, I like to use the term assessment. If you think about assessment as a social worker, I might think of it quite differently. As a health professional, people may think of assessment quite in a different way. And again, through education or through the police or through the court systems, each would be creating an understanding of assessment that may be slightly different. So we may use the same words, but they may mean conceptually different things. So we come from different cultures, we use a different language, and of course, relationships are therefore very important to kind of build the trust, to build the relationship, to be able to take risks and challenge one another safely, but also to consider each of from our own perspectives and our own siloed work agency involvement and how we might start to work together in a different way. I think one of the things that's been crucial and is still being developed, I think, in North Strathclyde is the kind of elements of developing joint processes and really thinking about the journey for the child and what joint processes that at certain points are going to be required, the protocols of working together so that people actually understand their roles and responsibilities, and there's agreements about information sharing. So all of that stuff that underpins effective multi-agency working seems very crucial to ensuring that people are operating together. It needs constant kind of vigilance, I think, and it impacts the way in which people are going to work and operate together. I think another kind of key element of multidisciplinary working and creating systems change has been in North Strathclyde, the leadership, Children First as a third sector leader, to really driving forward the Bairns House, finding the funding for it, being a campaigner to make change happen. They have a very strong vision about and a core elements of the principles required around a Bairns House and the delivery of that vision. They have a constant challenging of the mindsets, and I think that can be done very reasonably. I think that the example earlier about challenging the child perspective, adulthood perspective, and really listening to the child about what harm the systems might be doing and focusing on the child is actually really important. They have created very creative and responsive approaches, which has been flexible and supportive to actually developing the Bairns House. And I think Children First have clearly influenced the national agenda for change. Have had a serious amount of energy and drive to make it happen in North Strathclyde, and have taken an opportunity to get funding and seen it and worked with partners in North Strathclyde, the police, the local authorities there, the health and court systems to really get the house up and running. I think there are challenges though with the third sector leadership, and I think some of the professionals that we spoke to talked about the challenges of legitimacy of a third sector being the lead, and professionals' capacity. So the recovery workers have dealt with some, not resistance, it's just a lack of really knowledge about what the recovery offer is going to be, and thinking about they have a limited resources, so they're often trying to find funding to be able to deliver the work that they're trying to do in North Strathclyde. They have a mixed role, so this delivering services directly to children, but also doing this campaign work divides their capacity, and it means that they it's often challenging for Children First to be able to deliver on that. So moving forward, I think this is a great quote from one of the professionals we interviewed. I think kind of it culminates all of the tensions that I've been talking about in the multidisciplinary working, but also the partnership area of how valuable and important partnership is. So I think the most important thing is that in the partnership as a collective that everyone has a clear understanding, not just about what they're trying to achieve actually, but how they contribute to that and what is their unique contribution and are they being valued in the partnership. And I understand that for some, you know, people approach things differently and take longer to get the air. And it's not necessarily that they don't agree and with what's happening. It's just their own process. If you've got a lead agency that understands all that, I don't think it matters who the lead agency is. So I think it's really important to kind of put a bit of energy into the partnership and to think about the relationships that are being built up in and value the partnership. And also that I think really helpfully the professional 12 is kind of identifying that people come to partnership in different ways and for different purposes, and they have different ways of operating. But to really value the partnership and people's contribution is crucial. Otherwise people turn away and are not kind of fully committed to the agenda for change and the why. Okay, so I'm going to move to the North Strathclyde Bairns House space. This is some of the photographs of what's actually happening in North Strathclyde. Many of you may have actually visited North Strathclyde. It's a fantastic building. and much to the credit of the people who were building it. I'm just going to talk to you about where we are at about space in phase one. So one of the things that we talked about was that in first phase, we really identified a multiple negative experience associated with existing space where children were required to undertake forensic interviews or provide evidence to court in North Strathclyde. These experiences undermined children and families' emotional and physical safety and led to further distress at significant points in contact with both justice and welfare processes. Key concerns really related to the institutional intimidating nature of buildings, unwanted contact with either unknown individuals or, in the case of court proceeding, perpetrators, minimal comforts of distractions and limited levels of privacy, where family members could hear the interview going on as well. There also reflects evidence from wider research that formal institutional and adult-centred spaces for welfare and justice contribute to children's feeling of disruption or powerlessness and trauma. So, and a reminder of what the space is meant to be within North Strathclyde. It's really about enhancing children's, in contrast to what I was just saying, enhancing children and families' comfort and sense of safety to kind of better engage with justice and welfare services, to minimise the different professional contexts that they have to go into so that children come to one space rather than many, and improve multidisciplinary, collaborative and coordinated working. So what have we found out about space? Well, the child interview team uses space very effectively. It has had a significant impact through the provision of the new resources supporting children's joint investigative interviews. As I said, 68% of interviews in North Strathclyde are occurring in the North Strathclyde Bairns House, and it is the venue of choice for many. It's an improved, calmer experience for children, and there's a high level of trust in the equipment to produce best evidence. There's really a very strong perceived improvement in the quality of evidence that is being gathered by utilising the equipment and doing the interviews in North Strathclyde. And as you can see from the focus group respondent here, is the quality of the recordings is really at a different class. So they think that it was great feedback for all the team that actually, you know, it's not just a nicer place to come to technically, that you know that it's actually a far better interview and the recordings will be much better, and that the children appear to be much more relaxed. The children's experiences of space, and I need to say that the children that we interviewed hadn't done their interviews in the Bairns House, their joint interview in the Bairns House, but they were interviewed by us in the Bairns House. So they're talking, when they're doing the chat about the Bairns House, they're talking about how they're feeling about being in the space at the time. So there is a definite sense of safety and calm being produced by the Bairns House for children. They're experiencing it as a sense of calm. They see it as being very distinct from other institutional settings, if I can get my words out properly, and that's making a big difference to them feeling calmer and promoting a child's sense of control in the environment, and also a child-centred values, which all has a sense about really embedding children's rights in the Bairns House itself through the space itself. Lucy talks about it would have been better to do an interview here at the Bairns House. You know that it's for me here. They're kind of coming here for me. It's on like my side. I know if I want a break, I can get a break. When it's here, when it's there at Osprey House, which is the traditional area venue that child interviews took place, it's on their territory. You've got more support here. Their Osprey House is more intimidating and you just feel like you need to get it done under pressure. Here it's more obvious. If you need a breather, you can take a breather. And Lucy's testament just is such a lovely way of expressing the fact that she has much more control over a situation that is extraordinarily traumatic and difficult for people. So actually it's fantastic to hear that the space itself would be making her feel a sense of calm and a sense of control over a situation that is difficult. So the wider impacts of the space, it's very much supporting multidisciplinary working. There's a definite, at the end of phase one, the communication between the recovery team and the joint interview team was happening, but it was fairly minimal. Now there's a very strong multidisciplinary working approach between those two teams. And I think it's very much supporting professional working experience and their associated wellbeing and about doing the job that they're doing. And again, we will all know that the experience of having to undertake and hear stories of children who've gone through trauma is actually has a high level of vicarious trauma. And actually what we were hearing really from professionals is that the working experience and their own wellbeing was being supported by the building itself. And it was embedding a child-centred and a rights value base to the work that people felt that they were being able to deliver. So there are limitations to the space, and there are challenges and next steps that North Strathclyde need to consider. So the limited space of the Bairns House, so it's quite a small bungalow that's been converted, and it doesn't have co-location opportunities in that space. There are, so, you know, the management teams have and strategic leaders have really thought about how can we get co-location in other ways. The geography of 4 local authority partnerships that North Strathclyde Bairns House covers is limiting, and it means it doesn't always make sense for children and families to travel to interviews or do recovery work in the Bairns House. I think that sometimes the choice for children around recovery work, where they might want to meet recovery workers, where they might want to undertake particular work, they may not want to do that in the Bairns House. It's not quite big enough at the minute either to actually do full-on recovery work and the interviews. So it lends itself to other spaces and finding other spaces to work in. And really at the time of writing, the full potential of the space is not being met. And what I mean by that is the health spaces and the court spaces were really just beginning to hold potential, but weren't being fully utilised yet, which could have potentially really significant changes on children's experiences. And the forensic medical examinations are not going to happen in North Strathclyde, but there could be wellbeing assessments done for health in the North Strathclyde Bairns House. Okay, I'm not quite sure about time because my clock's going quite quickly, but if you can let me know when I need to speed up a bit, that would be good, Rachel. So I'm going to talk through about the recovery. The recovery support really represents a significant change in the pathway for children through North Strathclyde Bairns House. It's like the child interview model in the space. It's a significant element to the delivery of the Bairns House. It was recognised as a serious gap, and it now provides a consistent holistic offer to children for all children who undertake a forensic interview. And it's being delivered by Children First. And since 2020, but it's now since the Bairns House opened in August 23, as I said, they have a duty system where a recovery worker will meet with family members as they come in for interview, and that's made a big difference to actually families taking up the recovery service. They've supported 153 children since the Bairns House service and 278 since the start of the service. 67 of them are female, 31 male, 1 transgender, and 1's been unknown. 1% is unknown. 9% of those children were 0 to 5-year-olds, 32% 6 to 11-year-olds, and 58%, so the majority of children are young people, 12 to 18-year-olds, and 9% of those children that the recovery service is supporting are looked after and accommodated and involved with children and families services. I think one of the things that we've been trying to do within the evaluation team is think about what the values and principles that the recovery support being offered by Bairns House has really tried to create and work within. So it's very much around a relationship-based practice and thinking about the flexibility of what the child needs and being very child-centered and responsive to the child's needs at various different times to support child at different points on their pathway and journey. It takes an ecological and systems approach, so the child is wrapped up in their family and their community and their friendships and their schools, and really thinking that the recovery workers working with different elements of the child's system to support the child and the family to support their recovery and well-being. It's very much a family inclusive support, and the evidence was really strong from children and family members about the support, children observing the support the family members were getting, and then having a sense of relief around some of that. And I can talk a bit more about that. It's very much about strength-based approach, so thinking optimistically and hopefully that the family will recover, that there's a lot of strengths within the family that we can build on to be able to support them after child maltreatment and abuse. It has a strong children's rights base, and I think that comes kind of flows through all that Children First do, very much about child focus, but thinking about participation particularly, and engaging children at their level and appropriateness, and the way and manner in which they encourage participation for children and their family members. And it's open-ended, which I think is much to the credit of Children First. So it's as they come into the Bairns House, there's an open-ended offer that families can come in and out of support, but that support would be offered if they needed it at certain points on the journey over the months that they might be involved with the justice system as well. I think a core element is that staff are really authorised and are given permission to really implement a child-centred model. So it's really focused on the type and nature of the work that they're doing really reflects what the children and family might need. So help with housing, to being able to support children to go to school, to kind of buffer against systems. So communicating, going to talk to going to speak to schools about what's happened and being able to be a buffer to the system to introduce what's going on to others, to other agencies as well. So recovery rights and advocacy support looks different for every child, and the challenges and opportunities around that are really significant, both for the offer for children, but also the resources for it as well. So the recovery support that's been offered, I think, is a kind of multiple elements that go on here. So they get access and engagement, which often comes through that face-to-face meeting at the beginning of the at the Bairns House, and they have an active outreach to keep in touch and offer interim support and provision if required throughout the journey that they're involved with Children First. And it's a non-pressurised support. So children may say no at a certain point, but come back to them afterwards, and that's been really well received, that it's timely and appropriate, and it's not pressurised. So there's an open door to getting late support if required. Now, there are kind of three core elements that we think is happening within the support being offered, and there's a development of a relationship, so really thinking about getting to know a child in their ecosystem, in their family, in their community, and also that really building a level of trust with a family, and helps to identify what the needs are for the child. Fostering a sense of kind of care and mattering, so children are really recognised within that relationship and feel really important and valued within it. It's kind of the core foundation to the work that's happening with Children First and the recovery workers with children and through the Bairns House. The third element really is the fostering and safety and stabilisation. So really thinking about trauma-informed work, about stabilising and thinking about holistic safety needs for the child and of the child, both their emotional, their physical and relational, and thinking about what the needs are of the child and the family to be able to support addressing those needs, and really thinking about recognising the relational nature of safety and what that means for children who have gone through a level of abuse and maltreatment. And also the repertory work and reparative work and the modelling of safe, healthy relationships that can happen with the recovery worker, but also seeing that happen with their parents and or other relations and family networks. And then finally, it's really thinking about the tailored support options that are required. So thinking about advocacy, therapeutic inputs, psychoeducational support, planning for the future, and group work and peer support, participation and influencing work. That's all kind of thinking about ways that that can provide support options for children. So planning is really important because it's obviously linking into wider planning for the child as well. So the children and families' experiences of recovery is very strong evidence that this is really important and very valued. It's distinct from most prior other experiences. So children are saying this is quite different to other support that they may have been offered before. The children and family members highlighted the issue of consistency, reliability, time spent with the children, just getting to know them, being able to talk with them, the holistic focus and informality of the recovery support that's being offered. And I think associated with those qualities, with self-reporting and positive outcomes, that they have a sense of feeling seen and feeling heard, feeling valued and trust, and that all has impact on the child's sense of self-worth, their self-esteem, their self-value, which is obviously very vitally important after the experiences of child abuse and maltreatment. I would say the recovery work is just someone that you can rely on. If you want to speak about serious issues, there's room for that. But also, if you don't have to immediately. There's no pressure in it. The Children First, with Children First, a lot of the time, it's a lot more lenient than other services in how long you work with a worker and what you work on and whether you want to work on like big issues or just talk to someone. So again, supporting children's safety and stabilisation is really crucial. So, and it's noted really the limits of the children in their court processes and feeling being able to provide some level of safety and stabilisation through that process has been really important. And thinking about the single point of contact and being able to buffer children from complex and wider systems, I think, has been really crucial. So thinking about a child knowing who they can go and talk to if they want to ask questions, and it's been a massive help to children around reducing their level of anxiety about what's going to happen next when they can go and speak to somebody close to them that they trust about what's going on. I think there's future considerations for the recovery support. I think one of the key elements that came out from professionals across the board really was the process for recording and sharing, obviously with consent, the assessment that was going on in recovery, and to be able to link that to multidisciplinary work with children and families across the board, and to avoid duplication of both asking children's questions, but also that children are needing to tell the same story over and over again. So really linking in the recovery service with broader systems that across North Strathclyde. Really, there was a very clear message that there needs to be clearer pathways into and from clinical support where needed, so that it's not that this recovery model isn't the only recovery model being offered to children, but actually that that when clinical support's required and needed, that there's a kind of clear pathway between this recovery model, Bairns House, and, for example, the child and adolescent mental health support. Protocols for information sharing and joint planning is really crucial and needs developed in North Strathclyde, and I think further collaboration and coordination about within the multidisciplinary context. So thinking about the kind of process, that map that I showed you earlier, from initial referral discussions through child's planning and getting it right for every child approaches, right through to hearing system and other court systems that a child might be involved with. So thinking about how these recovery supports can both enhance and support enhance co-working, but also enhance the child's experience through that pathway. Embedding the use of standardised measured across the Bairns House, I think, is also going to be really important to say are there ways that there standardized measures around well-being that could be utilized to understand the changes that are being experienced by children and their family members, and that we can measure that, and securing future funding for services outside standard statutory elements. Okay, so I'm probably aware of the time. I'm going to miss these. I think you can come back to those. I think in summary, really the phase 2 summary is that the justice and recovery journey after identification of abuse is still very difficult for children. There's it can't be easy, obviously, but there is strong evidence that the Bairns House approach has helped improve children's experiences even after 6 months of it being opened, and supporting the recovery process for children. It's an important and valued and trusted resource. As a space, it's very important, but also as a kind of approach, I think it's becoming a really trusted resource as well, both for the child interview team and the Children's First Recovery team, particularly at this early stage of development. It's becoming a really supportive way of encouraging multidisciplinary working. And I can't stress enough to really say how enormous and complex a project Bairns House is in developing it. It sounds simple, but actually it is very complex, and it creates challenges and the complexity and the context in which we're all working to deliver it can create challenges for partnership working. And I think it's very important to value the partnership and the relationships within the partnership, and have spaces to be able to have difficult conversations, will really aid the development of the Bairns House progressing. So Rachel, that's me. If there are any questions.